that is campaigning, I suppose, in the year 2021. So again, thank you very much for being here this morning. We are here to talk about something that, to be honest with you, at the beginning of this General Assembly session, I think it probably would have flown under the radar and maybe should have, because us as government officials, I was planning on us doing our jobs, which is to make sure that those that we have been calling heroes for this past year in the fight against COVID-19 would actually get the kind of compensation and benefit from our government to which they are entitled. Unfortunately, we are here towards the tail end of this now special session without any resolution in this case. To give you a brief background, what we're talking about here is a presumption of workers' compensation for those people who we have charged to go out into the public or to receive infected COVID patients and to try and take care of those who have been infected with this terrible virus since March of 2020. We know that there have been nearly 200,000 healthcare workers across the country that have contracted COVID-19 in the past year. And sadly, nearly 3,000 of them have died. We know that healthcare workers are 10% more likely to contract COVID than the regular population. And why is this? Because we know in our emergency rooms and in our intensive care units and in the back of our ambulances, those who have been infected with COVID-19 have exposed themselves and exposed the virus to those healthcare workers. And remember, a year ago, there were so many challenges that our hospitals were facing to try and get proper protective equipment for those frontline workers. And the kind of exposure we subjected them to over the spring and summer and fall and winter has been, in one word, horrendous. And yet they've done this work every single day because it's their mission, it's their job, it's their passion. And so what do we as society, what do we as the Commonwealth of Virginia believe that they are entitled to if they've contracted COVID-19? Well, if they have to take time off of work and they have exorbitant medical bills, to me, I think it should be fairly simple that we say that those workers had a presumption that they got COVID-19 on the job if they are directly taking care of those who are infected with COVID. But unfortunately, where we are right now is we're at an impasse, and we're calling on the public to reach out to their members of the state Senate to try and see if we can't get this taken care of once and for all for those heroes that have been on the front lines for this past year. My House Bill 1985 would have given a presumption for workers' compensation for those healthcare workers who contracted COVID-19 while taking care of those infected. But without retroactivity, and our bill would have had retroactivity back to March, to basically say that all of those people for the past year, we would give that workers' compensation presumption, it should be a no-brainer. But unfortunately, the Senate has amended that bill, just as they've amended Delegate Jones's bill, to say that no, the only people who would be entitled to this workers' comp benefit would be those who have contracted COVID-19 from July 1 of this year until the end of the year. Now, we know that so many healthcare workers have already been vaccinated twice. They are protected against the virus. We think that there might be a chance for us to say out loud that this pandemic may start to become in the rear view, or that there is a light at the end of the tunnel. But what do we do for the hundreds, if not thousands, of healthcare workers here in the Commonwealth of Virginia who did that onerous task, who did that job that nobody else wanted to do, and exposed themselves to COVID-19 and got it? And now are facing debilitating complications because of that and are no longer able to work. We should give them a workers' compensation benefit, just like we give other first responders who have contracted other communicable viruses in the course of their job, like hepatitis or HIV, just like we would say that black lung is an occupational disease for our coal miners in Southwest Virginia. We should say that COVID-19, for some professions, is an occupational disease, and it should be retroactive, and you should be entitled to a presumption for workers' compensation. You may be thinking, yeah, this seems simple. This seems like something we should have already taken care of in the General Assembly session, and I wish I could tell you that we have. But right now, we need the Senate to agree to the House's position. And that's why we've called this press conference today. We are going to be hearing from some of those frontline workers who have contracted COVID-19 and are facing just horrible health consequences as a result of it. But before that, I want to give an opportunity for some other advocates and for my colleague, Delegate Jay Jones, to be able to share their thoughts on where we stand today. So Delegate Jones, thanks for being with us, and please tell us more about your bill.
Yeah, thank you, Delegate Hurst, and it's a pleasure to be here with everybody this morning. As many of you know, this is not no stranger to me, this bill. I had a bill during the special session that would have done exactly what we're talking about right now, but it was deemed to be too unwieldy and too costly. And it's disappointing. As a member of the Appropriations Committee, along with Delegate Hurst, the House has prioritized these heroes day in and day out during this crisis to provide them with the opportunity to have the presumption under this workers' compensation framework. Now more than ever, we've got to prioritize our heroes who put themselves on the line over the last year. The retroactive presumption, which is why we're here today, because this legislation is all about the retroactive presumption to coincide with the start of the state of emergency back on March 12, 2020. It underscores our commitment to working people who have made the ultimate sacrifice to keep us safe during the most challenging public health crisis that we've ever seen. And my bill, House Bill 2207, includes emergency medical personnel, law enforcement officers, correctional officers, and firefighters. Along with Delegate Hurst's bill working together, we think that we cover all of the folks who have really been putting themselves out there to make sure that the trains still run on time and that everybody can continue to operate, even in strange situations with quarantine, as we should. And we owe these folks a debt of gratitude. We honestly should be lifting them up as the heroes of our time. Never before have we seen a crisis like this, and to not provide the retroactivity in this bill would be sort of nothing short of disgusting. And frankly, the Senate of Virginia has been obstinate in this regard. We'd like to see them get to the same level at the House with the retroactivity clause. There have been a lot of red herring arguments that have been thrown out as to why this can't work, why this is not practical. But I would submit to you that we've done this before and we can do it again. And now is the time for us to get on board with the House position, the bills 1985 and 2207, to provide retroactivity under the workers' compensation framework for the provided groups. And I'll kick it back to Chris now to hear from the other advocates, but I urge everybody to please contact the senators, especially those on the Finance and Appropriations Committee, to tell them how important this is. Because if we're not demonstrating to our workforce that we care about them, that we can provide for them, that we want to honor them during these times of sacrifice, I'm not sure what we're even here for as legislators.
Thank you very much, Delegate Jones. We want to hear now from a representative from the Virginia Nurses Association and Mary Kay Goldschmidt. Mary Kay and I have been working this legislative session, and things have been progressing nicely, but we've been having an eye towards the Senate. And again, this refusal to adopt retroactivity continues to be our difficulty and why we're here again this morning. Mary Kay, thank you very much for being with us, and please share more of the perspective from our healthcare heroes.
Thank you, Delegate Hurst. I'm happy to be here. I'm speaking on behalf of 110,000 plus registered nurses in the Commonwealth. We've all been referred to as healthcare heroes because we work face to face and manage this terrible virus, and we're on the front line of the pandemic. We know through CDC data and other published studies that healthcare professionals are at least 3 times more likely to contract COVID on the job than they are in their communities. What you may not know is that nurses comprise the largest group of healthcare providers and including first responders who contract COVID and also who die from the disease. There are more nurses who capture this disease, unfortunately. And nurses are equally impacted by long haul COVID, which you've all heard of, with ongoing significant symptoms and require ongoing treatment. Many have been unable to go back to work. So you can imagine the impact, the fiscal impact on these families and their loss of income. We thank Delegate Hurst and strongly support House Bill 1985 to help our healthcare heroes get the workers' compensation they're entitled to. And unless it's applied retroactively, it will almost help no one. So as it was unanimously approved by the House in this form with a March start date of 2020 and a stop date of December 2021. Without that retroactivity, it becomes nearly useless. And we want this available to our healthcare heroes and to help those who have been disabled and unable to work. Unfortunately, as you heard Delegate Hurst mention, the Senate amended the bill to apply only to healthcare workers who are vaccinated, but still contract the virus between this coming July, through December of this year. And that's just unacceptable. It does not fix the problem. And you may know this, all but 2 states who have enacted a presumption for COVID made it retroactive. I think there are about 13, maybe 15 states who have done so. And those 2 states that did not make it retroactive did not do so because they enacted a presumption in March and April of 2020. So while healthcare providers are grateful to have been prioritized for vaccination due to their high risk of exposure, OSHA rates nurses among the highest risk. It's anticipated that it's going to protect many healthcare providers going forward. But in light of the variants that we're now seeing in COVID and the 94% efficacy rate on the vaccine, it won't cover everyone, and particularly those who are unable to take the vaccine because of certain health conditions. And many of our mothers who are pregnant and nurses have been unable to take the vaccine at this time. So we did seek to narrow this bill and make it a more narrow bill and apply only to those who worked directly with COVID patients. And again, a March 12th, 2020 start date, December 2021 stop date. So we are working with the fiscal impact and trying to manage that as much as is possible. But what you should know is that out of over 20,000 healthcare providers who have contracted COVID, only 230 have been able to successfully prove they contracted it on the job. So the system is not working for our nurses. And let me close with just a couple of brief remarks from nurses that we've heard from, and these are direct quotes. A month after contracting the virus, I'm still fighting pneumonia and other serious complications related to COVID-19. I have medical bills piling up and no idea when I'll be physically strong enough to return to work. Workers' comp would cover my medical expenses and lost wages, yet the current laws will not allow me to claim it without proving a direct link to a specific positive patient, which is very difficult to do when you're working with 20 COVID patients in a day. I ask that those of us who have bravely served the Commonwealth during this scary and vulnerable time be cared for during our personal time of need. And then finally, one more brief comment, and we've gotten many from our membership who've echoed these issues. I'm a registered nurse working on the front lines of this pandemic. I did contract COVID-19 earlier this year as a result of caring for COVID positive patients at the bedside in an acute hospital setting. I was out of work from April 2nd to August 2nd of 2020 as a result of my illness and recovery from COVID. I was only compensated for the first 2 weeks, which was financially devastating for me and my family, and workers' comp would help us significantly. And just one final comment, we ask you to remember those RNs who died from COVID during the past year. There have been many. Their spouses and children could greatly benefit from the workers' comp death benefits to help with medical bills and the permanent loss of income among their families. This has to be retroactive. We can't leave any nurses behind then or now. And we urge you to support House Bill 1985. Thank you so much.
Thank you very much, Mary Kay. I think, again, the 2 words to keep in mind here, folks, is heroes, and we need it to be retroactive. Other heroes who are in this fight trying to get retroactivity are our firefighters. John Wright from the Virginia Professional Firefighters is here with us. He's from Northern Virginia, Northwest Virginia. John, it's good to see you. And please also share the context of how firefighters have been exposed to COVID-19 and how they need this workers' comp presumption as well.
Absolutely. Thank you, Delegate Hurst and Delegate Jones, for your leadership on this critical piece of legislation, protecting our nurses, protecting our firefighters, and our paramedics and EMS providers. For those of you who don't know me, my name is John Wright, and I am the Legislative Director for the Virginia Professional Firefighters based in Richmond. We represent about 9,000 professional firefighters and EMS providers who serve all across the Commonwealth. Nearly a year ago to the day, a deadly virus first appeared here in Virginia and across the United States. In response, Governor Northam declared a state of emergency. He ordered businesses to close, limit their hours if they were essential. He encouraged Virginians to stay home and slow the spread of this highly infectious disease. For Virginia's firefighters, EMTs, our paramedics, and our nurses, staying home was never an option. These frontline workers have been and continue to be the first line of defense against COVID-19. They continue to do what they swore an oath to do, and that is to save lives, risking their own health and safety to save their neighbors, their friends, and our loved ones, from this deadly virus. As a result, from the firefighters' perspective, hundreds of our members, our firefighters, our EMS providers, have contracted COVID-19 through direct occupational exposures to COVID-positive patients. Many of these heroes were left fighting for their own lives as a result on ventilators and ICUs all across the Commonwealth. They sacrificed their own health to help others. Now these frontline workers are left with thousands of dollars in medical bills, and many of them with lingering health effects. Some who have yet to return to work, others who may never return at all. That is why the Virginia Professional Firefighters, during the special session last August, asked Senator Jill Vogel and Delegate Jones to sponsor legislation that provides workers' compensation benefits that are retroactive to the beginning of the pandemic. The Virginia House of Delegates passed this critical piece of legislation with bipartisan support. Unfortunately, the Virginia Senate was unable to do the same, and the bill died in the Senate Finance Appropriations Committee. Still recognizing the need to protect our heroes, Senator Vogel, Delegate Jones, and Delegate Hurst reintroduced this critical legislation for the 2021 Virginia General Assembly session. The House of Delegates has passed House Bill 2207 and 1985 with retroactive coverage, that component unanimously. Unfortunately, on the Senate side, the Virginia Senate has removed the retroactive coverage from their version, Senate Bill 1375. In doing so, they're leaving behind hundreds of firefighters, EMS providers, and nurses. As we move forward, and these bills are now headed to conference, where 6 lawmakers will make the decision of whether or not retroactive is included and whether or not these bills will come back to the floor of the respective chambers to pass. As we move forward and these bodies work out their differences, we encourage the senators to reconsider their priorities by including that retroactive coverage, which is the intent of this legislation. To all the legislators, early in the pandemic and throughout, we were seeing public comments made by our political leaders all around the Commonwealth, calling nurses and firefighters and our frontline workers heroes. And we don't view ourselves that way. This is our profession. We chose to do it. But if legislators want to call us heroes, we appreciate that. But prove it with actions and not words by passing this bill as the House version with the retroactive coverage. Thank you again for your leadership, Delegate Hurst and Delegate Jones, on this.
Thank you very much, John. We are going to be hearing from some of those frontline heroes in a little bit with some prepared statements. Being able to talk to you all via Zoom instead of in person gives us the opportunity to hear from those individuals directly because of their compounding and often complicated health issues that they've been dealing with. We're going to hear from them in a little bit. But before we do that, I want to open it up to all of you, members of the press, to ask any questions to any of the 4 of us about what you've heard and where we kind of go from here. John alluded to it, that these bills will go into conference, but it is our hope that we can come out of conference with something that, as John said, rewards those that we've been calling heroes for the past year. So if there's any questions, feel free to either raise your hand, put it in the chat, or just go ahead and unmute yourself and ask a question. right. Without any questions, I mean, I'll be frank with you, it seems fairly straightforward to me. And when we've talked about it with members of the House, we said, you know, all those people we've been calling heroes for the past year who put their life on the line, you know, some of them are really, really sick now. Shouldn't they get workers' comp? And the answer is always yes. We just need to make sure that the entire General Assembly agrees with that. With that being said, are there any other questions before we go ahead and play the statements from those heroes?
I had one quick question. This is Greg Schneider at the Washington Post.
Hey, Greg.
Hey, what is the estimated fiscal impact of the bills?
I'll let Jay speak for his. For mine, there is an indeterminate impact. So just to let you know, the Hospital and Healthcare Association has come out neutral on the bill after protracted conversations with the healthcare worker associations like the VNA. Remember, they would be paying a lot of the workers' comp benefit if they are employees of those various hospital systems. If you are a select state employee or local employee who has some of their salary subsidized by the state and are a healthcare worker as defined in the bill and contract COVID-19 under the terms in the bill, we've estimated that there would be a total fiscal impact for the state of about $2.5 million, and the House has appropriately put that already into their budget.
And Greg, I would say the same thing for our bill. It's indeterminate on the fiscal impact statement, but the House has budgeted several $1 millions for this provision. We did so during special session as well. So clearly this has been a priority for the House of Delegates. These bills passed with bipartisan support twice now. To hear the Senate tell it that if there was a retroactivity measure in this, the cost would be astronomical. I've not seen a number or heard a number from them on that front. So I'd be interested to hear what the Senate Finance and Appropriations folks would ascribe to these particular measures. But the House, we've got a concrete number. It's in our budgets. And I think that reflects our commitment to these heroes.
Thank you.
Thanks, Greg. Jacob.
Hi there. Yeah, Jake Burns with CBS 6 in Richmond. This question is actually for Ms. Goldschmidt or Mr. Wright. Do you guys have a direct number or even, kind of a ballpark on how many of your members have actually contracted COVID to this point? I kind of heard some, general numbers, but do you have any specifics on just the exact scope of that?
Hi, Jacob. Mary Kay here. No, and we have tried. Virginia Department of Health is collecting some data, but their data is basically for all healthcare professionals. We know there are over 20,000 who've contracted. We don't know exactly how many are nurses because they don't break down the data in that way. I spoke with one of the statisticians at VDH and it's not collected in that manner. So no, I can't give you an exact number, unfortunately. Nurses will be, though, you'll see that the largest group. They'll comprise the largest group who've contracted COVID because they have far more face-to-face time with patients and repetitive face time. And if you remember early on in the pandemic, personal protective equipment was not accessible and was reused over and over and over again. So the numbers would have been even higher, I think, early on.
The bill defines healthcare worker to be broad, but remember that specifically in the bill, it says that you would need to, in the course of your job as a healthcare provider, to be treating those who have COVID-19, to have that direct treatment. And so you heard from Mary Kay there, Jacob, that about 20,000 healthcare workers overall in the Commonwealth of Virginia have contracted it. And the bill would allow for those people to be taken care of in addition, including all of the nurses as well. So it would incorporate a couple of different boxes there.
Jacob, just on the firefighters side, same as Mary Kay has alluded to, it's hard to pinpoint the exact number because we don't have access to that data. A lot of it's not being shared by the localities or our fire chiefs in our case. But we do know just a ballpark number, we're in the hundreds as far as firefighters who have contracted COVID through an occupational exposure.
May I make just one more quick comment? One thing that may help you, Los Angeles County, California puts out detailed data on the breakdown and percentages of each healthcare profession. And they just published something early February. So Los Angeles County public health data on healthcare providers gives a lot of detail, and nurses are at the very top of the list. I think was about 33%. And it addresses law enforcement and various other folks. That's not Virginia specific, but it may give you some additional information to be helpful. Thank you.
Very good. Thank you, guys.
Okay. Well, again, I appreciate everybody's time this morning, and I have never really ever called a press conference before. So I think to me, it kind of underscores like the fact that I don't really sound the alarm unless I really feel like that alarm needs to be pulled. And it starts to really just get me angry, frankly, as we continue to talk about it. The more we talk about it, the more frustrated and angry that I get. We have an opportunity to have good governance at its best, but we are impeded right now by politics, unfortunately, at its worst. And so with that, Andrew and Kristen, if you have an ability to play the statements from the three heroes that we have, I think the members of the press would love to hear those statements.
Hi, my name is Christian Canales. I'm 34 years old, and I work for Prince William County Department of Fire and Rescue as a firefighter EMT. In April of 2020, I was hospitalized due to having COVID-19 and severe pneumonia in both my lungs. Along with running calls for patients that had symptoms of coronavirus, I was also exposed to coworkers that eventually tested positive for COVID-19. On April 1st, 2 members of the medic unit called out sick, reporting signs and symptoms of the virus. Over the next several days, their symptoms worsened, including difficulty breathing and fever. A week later, another coworker presented with symptoms of COVID-19 after reporting to work. That coworker tested positive later that week. Within a week and a half of being exposed to that coworker, I also started feeling sluggish and had body aches. The following day, the body aches worsened. I had a fever of 100.4. For the following week, my symptoms continued to get worse. I ended up getting tested for the coronavirus, but the test results came back negative. Due to worsening symptoms such as diarrhea, loss of appetite, uncontrolled fever, and difficulty breathing, I went to Fairfax Hospital, where they admitted me after finding that I had high fever and low oxygen saturation. X-rays and other tests were performed, and the doctors confirmed the positive COVID-19 and pneumonia in both my lungs, just based on the results of the chest X-rays. A coronavirus nasal swab was also done with negative results. I was then released the following day and told to quarantine at home and seek medical attention if my symptoms worsened. My symptoms continued to get worse, and after a couple of days, I decided to go to Stafford Hospital. A COVID-19 nasal swab was performed along with blood work and chest X-rays. My oxygen saturation was in the 80th percentile, fever of 103, and chest X-rays showed severe pneumonia in both lungs. After what the doctors called 2 false negative test results, the third test result came back positive. After several days of being admitted, I was then transferred to the ICU, or intensive care unit, due to uncontrolled fever reaching 104.5 and needing high flow oxygen of 40 liters to bring my oxygen saturation levels back up. After a week, I was then transferred to Mary Washington Hospital to their ICU due to the recommendations of the doctors because of the continued difficulty breathing. Plasma was ordered for my blood type to get ready for a transfusion. While waiting on the ordered plasma, my symptoms started to stabilize and improve. After a couple of days, I was moved out of the ICU and into the hospital's COVID unit. After several days of being monitored and being fever-free, I was then released and instructed to quarantine at home for at least 7 days. I was in a hospital for a total of 14 days. 9 of those days were spent in the ICU. My cost for the hospital stay was roughly $98,000, not including follow-up visits for the cardiologist and pulmonologist. Over the next several weeks, I quarantined and rested at home with help of family members, and I continued having difficulty breathing and tightness in my chest, but still with improvement compared to before I went to the hospital. Leaving the hospital, I had lost about 35 pounds, and I lost strength in my arms and legs. I started to work on walking again and regained my appetite. After several weeks, I returned to work on light duty. During the following weeks, I was seeing a county athletic trainer to work on my strength and breathing in order to return back to work. Approximately 2 months after leaving the hospital, I was able to pass a firefighter physical exam and I returned to full duty. I recently visited a primary care doctor to talk about some short-term memory loss that I've recently experienced. And I didn't have those memory losses before I had COVID-19. The doctor said that because of the low oxygen saturation and the high fevers, that I may have some damage to my brain, and I was referred to a neurologist. One of my coworkers that I was exposed to back in April is still working hard to come back to work full duty. The nurses in ICU and the COVID units from the hospitals were all amazing with treating and caring for me during my stay. Firefighters, paramedics, and hospital staff have been combating this pandemic for over a year now. We need to take care of our first responders as we begin to understand the long-term effects of the coronavirus. Thank you very much.
And next we'll hear from House Bill 1985 testimony from one of our nurses here in Virginia.
COVID. During the year 2020, I was
Nurses
assigned to one
take
of the
care of
busiest medic
whoever
units in
walks
my
in the
county.
door, risking our lives. A 6-foot distance when starting an IV or giving someone a bath. This bill needs retroactive
Go ahead
coverage.
and start from the beginning, Kristen, if you don't mind, real quick. Thank you, folks.
Hi, this is Holly Zimmerman, and I'm here in support of HB 1985. On behalf of myself and the thousands of nurses who have contracted COVID, nurses take care of whoever walks in the door, risking our lives every day. We work intimately providing personal care to patients. It's impossible to maintain a 6-foot distance when starting an IV or giving someone a bath. This bill needs retroactive coverage because we took care of COVID patients before we knew COVID was in Virginia. I've been a nurse for 34 years and dedicated my entire life to others. I've not worked since July 27th of last year when I had 3 seizures, memory loss, and severe respiratory infection. Now with heart and lung changes, weakness that requires physical therapy, and memory loss, my doctors deemed I still am not able to return to work. This is what's hurting our nurses today, the length of time to recover. As a single person, I really need retroactive workers' comp to pay life's expenses. I've completely depleted my savings and 401k. I've sold my car and am now living on $375 a month. My house and student loans are in forbearance. Otherwise, I would be homeless right now. Passage of HB 1985 will allow us to receive retroactive workers' compensation, allowing me to repair my credit and return to financial stability. Thank you for listening.
Thank you. And I think we have one more firefighter to hear from. And just so you know, we will be sending out a press release after this event, which will include links to all of the YouTube videos that you see. And in addition, we are more than happy to try and find a local heroes who have been impacted by this. If you are trying to find a local person for your outlet to start with for your coverage. So with that, we have one more testimonial for you to hear from before we wrap things up. Oh, sorry, I said that we'll be sending that last one in as a link. My apologies. If there aren't any other questions, again, thank you very much for being gracious with your time. Please reach out to either Delegate Jones or my office if you need any additional questions answered. And again, the nurses and firefighters would be more than happy to try and find people in the areas that you cover who have been impacted by this as you're working for coverage. So thank you all very much for being with us this morning. And we hope to be able to get this retroactive workers' comp benefit for these healthcare heroes and our frontline heroes as soon as we possibly can. Thank you all very much. Have a great day.